her left ankle, there's a limitation in that range of motion. It also has a quality to it that clearly isn't going to allow her the optimal range of motion through the ankle. So let's use floss to see if there's a way that we can alter this. So there are, again, some simple rules. I'm going to start with Lisa's ankle in neutral. I'm going to take the floss and I'm going to anchor the floss through the midfoot. Come over top. Keeping your ankle here, I'm simply going to wrap it around and you'll see it's 50% tension, 50% overlap. And I'm going to continue up the limb, moving in a distal to proximal direction. Again, restriction, 2 minutes. Doesn't need to be longer than 2 minutes. And I have many of my patients, I work with a corps of police officers right now, and they're using floss. And the fact is they'll do it 3 to 4 times a day. It's very, very safe. So my first intervention is as simple as keeping the floss on. Static application. Just the idea of there being a compressive force is tapping into the nervous system. There are receptors responsive to pressure. So we have an input already. And again, I would argue one that's relatively safe. It's as if I'm hugging the tissue. The second thing I'm going to do now is I'm going to create some motion, and I'm going to use my hands to create some external glide over those tissues. So again, the goal being, can I start to drag and mobilize tissues overlying bony axes over the tendinous arrangement, or get those underlying fascial layers to mobilize? Compression and shear. So we describe this as external glide on those tissues, where I use an external force where I can capture tissue. I can do something as simple as a long chain distraction and mobilize the joint. All of it input that is valuable to promote ankle mobility. The second piece of this puzzle when we apply floss is to now look at internal glide. And the internal glide is facilitated by movement. So now those tissues are being forced to glide underneath as Lisa initiates a movement, go into dorsiflexion, plantar flexion, and force it to the end range. And I can have her do 5 to 6 reps to, again, reinforce some of that underlying internal glide of those tissues. And then the last piece of this puzzle is to use movement as part of our functional application with floss to promote motion while she's in contact with the ground.